Good morning, everyone. Thank you so much for joining us for our COVID briefing on Thursday, March 25th. We will hear from Governor Spencer Cox.
Ladies and gentlemen, it's great to see so many of you here today. Thank you for joining us. We're here in Spanish Fork in Utah County at what used to be a Shopco and now has become a lifesaver, literally, as we come to one of our mass vaccination clinics here in the state. I want to thank the Utah County Health Department for making this happen. Commissioner Lee, it's great to have you here. Thank you. We appreciate all of our public officials that have worked so hard to get vaccines out. We're just overjoyed today, Abby and I, to be here with you. As you know, we will be getting our vaccines. We've had lots of opportunities to get the vaccine over the past couple months, and much to the dismay of members of my staff and others, we've declined every opportunity. We wanted to do it the right way, and we wanted to make sure that we weren't getting ahead in the line of anybody else, because in Utah, we made the determination it was the right one to focus on our most vulnerable first. And I'm not going to share the numbers. I'm going to let the Lieutenant Governor do that. But what I can say is that we've been incredibly successful here in Utah, as successful or more successful than any other state in vaccinating those who are most vulnerable, those over the age of 65 and those with the underlying comorbidities. And so yesterday was a really special day when finally we were able to open it up to everyone in Utah who wants a vaccine. As you can hear behind me, there are so many people here coming through every day, getting that vaccine and making sure that we're saving lives and we continue to drive down the transmission of this virus. And so I'm not sure exactly what word I should use to describe how Abby and I are feeling today. I don't know that words are adequate. We are excited, we're overjoyed, we're relieved, we're just more than anything else humbled and grateful as we reflect back on this past year and the miracle that is this vaccine. If you've had a chance to study it all, everything that went into these different vaccines really coming together, and the people that made it work, the science behind it, but everything that had to line up just perfectly, and so many people that worked around the clock to get these in record time, ensuring that they're safe for everyone. And then now we see the practical results as our case numbers continue to come down. We have Dr. Angela Dunn here with us as well, which we'll talk more about that. We had seen a little bit of a plateau over the past couple weeks with our case numbers. They were still coming down, but not nearly as quickly. And then this week we're seeing case numbers drop again precipitously, which is great news. And so we're very excited about that. Now today we will be receiving, I believe it's the Pfizer vaccine. We had an opportunity. We could have gotten whatever vaccine we wanted. I was going to get the Johnson & Johnson vaccine because we were worried about Johnson & Johnson hesitancy, and I wanted everyone to know that it's perfectly safe and a great one to get. But we haven't seen a problem in Utah with people wanting the Johnson & Johnson vaccine, and that's great news. And so we said, hey, whatever they give at that location, we'll take whatever it is, and found out that Pfizer is what they're giving at this location. So we encourage people again to get whatever. The best vaccine for you is the vaccine that's available as soon as you can possibly get it. So don't worry about the brand of the vaccine. They are all incredibly effective and incredibly safe. And so we're excited to be getting more and more vaccine into the state. The Biden administration, the White House has let us know that we have more coming, especially the Johnson & Johnson vaccine. That's where we're seeing the biggest increase in production. That's the newest one. And we expect to be getting thousands and thousands of doses of Johnson & Johnson over the next week and moving forward. So a surge in cases right now is completely avoidable, and we want to remind people that as restrictions lessen and change, we still ask you to please, please, please be careful. Again, get vaccinated. Make sure you get your second dose of the vaccination. Wear masks to keep you safe and to keep other people safe until you're fully vaccinated. All of those things that you've been doing, we need to keep doing because the end is so close and the end is in sight. Now, with that, I'm going to transition a little bit. We have, there is one issue that I want to talk about that many people may not be aware of. It's a sobering issue, but it's also a very positive issue. Now, unfortunately, as you know, we have had over 2,000 fatalities here in the state of Utah because of the coronavirus. As of today, I believe about 2,088 people who have lost their lives. FEMA has asked us to make this announcement because right now, with the passage of this latest bill in Congress, this pandemic relief bill, there is actually funeral assistance now available for families of loved ones who have passed away. So FEMA will be launching a program next month. Now, I want to be clear, we don't have all of the details yet, but the reason we're announcing this now is so that families can start to get their paperwork together so that when the details of the program are announced, that you will be ready to apply for that relief. This program that FEMA will launch next month will be aimed at helping ease the financial stress and burden caused by the virus. So under the American Rescue Plan Act of 2021, FEMA will provide financial assistance for COVID-19 related funeral expenses incurred after January 20th, 2020. So this is retroactive. Any families who have lost loved ones after January 20th of last year will be eligible. They will begin this funeral assistance in April. Right now, people who have COVID-19 funeral expenses are encouraged to keep and gather the following documentation. Eligibility for the program, the death must have occurred in the United States, and the death certificate must indicate that COVID-19 was an attributable cause of death. So indicate that the death was attributed to COVID-19, and you will need an official death certificate as well as funeral expenses documents, and you can get those from the funeral home if you do not have those. And then proof of funds received from other sources to offset that. I believe the eligibility runs up to around $9,000 at the high end, but again, it depends on what the expenses were and the available funding. Applications will be made directly to FEMA, again, starting in April, and in future press conferences, we will bring you announcements on how to make that happen. But for right now, you can begin gathering that documentation. Now, with that, just one quick note on our transmission index. We've been keeping you up. I'm pleased to announce that we have 2 counties in high, 23 in moderate, and 4 in low transmission, which means that we have a couple counties that are moving into moderate this week, and those are Garfield, Kane, and Uinta counties. So that is good news for those counties. And with that, I'm happy to turn the podium over to the Lieutenant Governor for an update and announcement on where we are with vaccinations and some other information. Lieutenant Governor Henderson.
Thank you, Governor. And I just want to welcome everyone to my hometown and the best city in the state of Utah, Spanish Fork. I'm really happy to be here and grateful for the Utah County Department of Health, Commissioner Sajkovic, Commissioner Lee, and all the others who are here and who made this happen. Thank you for that. I have a vaccine update that I want to give. So far, as of this morning, we have administered 1,232,991 doses of COVID-19. Those are shots in arms. That is the first and second doses combined. That is an increase of 152,952 doses over last week, which is really incredible. Also, I want to talk about, and the governor mentioned this, the percentage of our vulnerable population that have been vaccinated. And so those who are 65 years or older, 80% of them have received at least one dose. 80% of 65 plus have received at least one dose, and 57% of them have been fully vaccinated, which is also really incredible. And we want to really thank our local health departments and other partners for making that happen. It's been an incredible effort. For now, the first age-based eligible population that we had was 70 plus, 70-year-olds and older, and 83% of them have had at least one dose, and 67% of them have been fully vaccinated as of this morning, which we're really proud of and really grateful for. Now, this is the clearest path back to normalcy for all of us. And so we encourage everyone who is now eligible, and that's everyone over the age of 16, to go ahead and get your vaccines scheduled. It may take a little bit of time. You may have to wait a couple of weeks, but please don't hesitate, don't wait. Try to get that scheduled as soon as you can, because that's the way we're going to get back to normal. And to make this easier on state employees, Governor Cox earlier this week actually authorized 2 hours of administrative leave for all state employees who schedule a COVID-19 vaccination. And we just want to express our support to our state employees and to the supervisors and thank them for their willingness to be flexible and to provide that flexibility so that no member of Team Utah really is in a situation where they have to choose between getting the vaccine or doing their work assignments. We really care about each other, and this is one way that we can show it. And we hope that private employers throughout the state, if they're not already doing so, will follow the lead and do that as well and provide flexibility for their employees so that they can get their shots. Really quick, an equity update on our vaccine distribution plan for equity. You know, we want to make sure that vaccine administration in the state of Utah reflects our population, that we're not leaving anybody behind. This pandemic has affected everyone. It's affected some people more than others, and we want to make sure that just because a vaccine is available, just because someone is eligible, doesn't mean that they're actually that vaccines are accessible to them, that they have that accessibility. So we are really focusing on that. Last Friday, I visited the George Whalen Veterans Home in Ogden. Now, this was the first of many mobile vaccination clinics that we had that the state's deploying to help vaccinate residents and staff of long-term care facilities. Now, early on, the federal government did provide vaccines for long-term care facilities. But since then, people have moved in. There are new residents, there are new staff that haven't had the ability. So we're making sure that we're focusing on those long-term care facilities so that new residents or those who didn't have an opportunity last time can get vaccinated. And that's very important to us. We're also working with home health partners to provide mobile vaccination clinics to those who are in need. And we're going to expand this service to other congregate care settings in the coming weeks to include behavioral or substance abuse treatment facilities, group homes, assisted living centers. And in addition to the congregate care settings, local health departments are also working with their communities to set up smaller vaccination clinics. And I've got just a few examples of where this has happened recently and where it's going to happen in the future. Last week, the Utah Muslim Civic League worked with Salt Lake County Health to set up a clinic at a local mosque. Also last week, Southwest Health Department partnered with the Southern Utah Pacific Islander Coalition to hold a clinic in St. George, where they were able to vaccinate 280 community members. And I heard that was actually a really great event, and there was a lot of camaraderie and positive feelings there. The Bear River Health Department this week sent a mobile clinic out to Park Valley in Box Elder County in the far northwest corner of our state. And they had enough vaccines that day to get everyone in that town who wanted a vaccine, which was awesome. Tomorrow, Senator Mitt Romney and I are actually going to be visiting a Spanish community clinic at a senior center in Davis County. And next week, I will be visiting a clinic in Duchesne County. We are really, really grateful for the many people who have worked so hard to make this possible. I know the governor's excited, and I can say as his partner that I'm really excited and grateful that he and Abby, our First Lady, are getting their shots today. We will be very relieved when this is over and when our governor is safe, and we know that he is safe from this terrible virus that has affected so many of us in really long-lasting ways. We're grateful for the hope that this provides. Thank you all so much.
Okay, good morning. Our 7-day rolling average of new cases is now at 419. This is down from 489 last week. And our percent positivity is also decreasing. Person over person is now at 7.6% positivity. It was 8.4 last week. And test over test is now at 3.8, a decrease from 4.2 of last week. And our ICU utilization is continuing to decrease. Our referral ICUs are at about 72% utilization this week. You know, our cases are decreasing, and they're decreasing at a slower rate, like the governor mentioned. However, our leading indicator, the percent positivity, is continuing to decrease. So while that is still going down, it is great news, and that means that our cases will continue to follow, as will our hospitalizations and our deaths. So we need to continue, of course, to wear face coverings, physical distance when we can, and stay home when we're sick, and of course get the vaccine when it's your turn, which now everyone 16 and older can sign up to do so. We're here at Utah County at one of their vaccination sites, and I have to tell you, it is so organized, well-run, and efficient. We've got Utah National Guard, public health professionals, nurses, and other medical professionals all here to make sure that anyone who wants the COVID vaccine can get it. It's filled with hope and joy. And I had the opportunity to volunteer at the Salt Lake County vaccine site on Monday, and it was a similar experience. I mean, our local health departments are really the reason that we've been able to quickly get shots in arms. So I really want to thank all of the public health professionals out there for continuously dedicating their time and energy to this effort. You are the reason we are pushing towards the end of this pandemic. Thank you.
Thank you, Dr. Dunn, for that great report. Lieutenant Governor Henderson, thank you so much for your incredible work in helping to organize these vaccination efforts. I just again want to thank our public health professionals who are doing this and the volunteers that are here, the National Guard. We've never done anything like this in this amount of time with this many people. And the energy, you can feel it here, as Dr. Dunn said. It's a vibe, it's a thing, and it's a good thing. And we need more of it, and we just so encourage you to get out and get your vaccine. With that, we have time for a few questions, but I have to admit I'm pretty anxious to get this part done. So we're happy to answer some questions, please.
Governor, a few words in Spanish. ¿Cómo se siente al recibir la vacuna y qué le diría a nuestra comunidad hispana?
Okay, so the question was, if I could, for our Latino community, if I could share a few words in Spanish about how we're feeling about this opportunity to receive the vaccine. No sé cómo decirle, tengo muchos pensamientos y sentimentales sobre cómo estamos sentidos ahorita, pero estoy bien animado para tener la oportunidad de recibir este milagro. Y espero que todas las personas en nuestro estado que ellos pueden tomar esta oportunidad de guardar y salvar su propia vida y las vidas de los demás. Es una medicina que nos puede ayudar a regresar a normal. Más que nada, eso es lo que queremos y esperamos que todos puedan tener esa oportunidad. Gracias. Please, Ben.
Governor, given that you signed the endgame bill last night, do you anticipate health restrictions by July 1st lifting, or do you expect earlier given the trajectory we're on?
Yeah, well, so again, given the trajectory that we're on right now, and that could all change, but given the trajectory that we're on right now, we anticipate that those health restrictions will all be gone before July 1st. Certainly with the amount of vaccines that we're getting in, the rate of vaccinations, and the decline in case counts, we're on pace for that, and we're very hopeful. We did have a meeting this past week with the White House and with Dr. Fauci, and he was also very optimistic. He did say, of course, we're watching Europe. Europe has tended to be a little bit of a leading indicator for the United States when it comes to surges, and they've seen plateaus in many countries, and they've seen increased cases with some of the variants. But there is something very different this time, and that is that our rate of vaccination is so much higher than theirs. And even if we do see an increase in cases, the fact that we have vaccinated so many of our most at-risk population makes us even less vulnerable to the outcomes. I'll just remind people that, look, we have coronaviruses all around us all the time. Right? The common cold is a coronavirus. And so we're used to coronaviruses. That's not a problem. The problem is if it puts you in the hospital and kills you and does that at an excessive rate. That's the problem we're dealing with. So driving those numbers down, that's really what we've been focused on. And so he was very optimistic that we wouldn't see those kind of, hopefully wouldn't see those kind of surges that we're seeing everywhere else. So the answer is yes, we're very optimistic that we'll beat those timelines. Let's go here.
What have you seen in setting up appointments in the last week? What have you seen as far as regional differences? Some counties are taking to it quicker than others.
Yeah, what we're seeing. So the question is, what are we seeing with the vaccinations and the uptake and the scheduling as people are anxious to get scheduled? So what we're seeing is just an enormous push, which is what we were hoping for, and that's true across the board. We had seen demand changing in different counties based on those age restrictions that we had in place. One interesting note: Southern Utah, for example, was the hardest place to get a vaccine scheduled. St. George, Washington County, and that area, because they have a much older population. So we were actually moving doses and sending them down there. Now that's flipped a little bit. Now that, again, well over 83% now of our 70 plus have been vaccinated, they had lots of appointments available. And so this change has again helped to fill all of that. We are seeing things being scheduled out through April, and as we get more and more vaccine, we'll make more appointments available for people. But the good news is that this has been very well received across the state. No place lagging behind right now. No, there are certainly some counties. If you look at the measurements, some counties have a higher percentage of their population that have been vaccinated than others, and so we're working that. So some of that has to do with again the demographic makeup of the county. So Utah County is a good example of that. Utah County is one of the youngest counties in the state and in the nation, and so obviously those under the age of 16 aren't eligible for the vaccine, and so you're going to see, as a total percent of population, a lower uptake. But nobody's lagging right now. We're seeing great demand.
Speaking with some vaccine providers, they got the Johnson & Johnson. They say they haven't gotten more doses of that vaccine, and Salt Lake County has said the anticipated increase in allocation hasn't come to fruition. Are you aware of that, concerned about that? Could that delay the timeline for getting all Utahns vaccinated?
Yeah, so the question is around Johnson & Johnson that we were aware of this. The question is or the statement that we have had some Johnson & Johnson distribution sites who had vaccine early and then didn't get the anticipated vaccine. That was not a surprise. I mean, it was originally, but we were told that would happen by the White House several weeks ago, that they had 4 million nationwide that had already been produced, and they wanted to push that out. And then there would be a delay, only about 400,000 the next 2 weeks, which we just finished up. And then now the big increases are coming. So an additional 4 to 8 million over the next 2 weeks is what we've been told, which again are huge numbers. And then we're going to see that curve just go up exponentially. And we're also seeing an increase in Pfizer this week. So those numbers are really important. Nationwide, I think it's an increase of about 6 million total. That's big numbers, and you can kind of do the math for Utah. We're approximately 1%, although we're 1% of the total population. The adult population, we're actually less. It's about 0.83 because we're so young. But that gives you a little bit of a feel for what we're looking at with Johnson & Johnson. And we anticipate a lot of Johnson & Johnson coming in this week and next week as we move forward. It will, yeah, that will absolutely open up more appointments, yes. So we keep telling people, you know, even if something says they're full through April 15th, when we get, every week we get new information and we don't know what it's going to be. They try to give us some kind of general insight, but we really don't know until our call with the White House every week. We have no idea. Tuesday mornings we get on and they say, hey, this week we're going to have this much extra, and that's when we start, then we have to order it, and then we determine where we're going to put it, and then they open up that scheduling. So even if some place is scheduled out through April 15th now, in a couple days they could have new doses available like that day or the next day. So keep checking, be patient, keep looking back. But once you have one scheduled, don't change your schedule. If you do find another one, and please cancel. Don't have two open. That's where we're taking a vaccine away from someone. Thank you. One more question. Anybody have one more? Not seeing any. Okay. Well, we won't have one more question. Now, in advance of this, I have to warn you about the gun show that is about to happen. I will just say that every day is leg day at my house in Fairview, so please with the memes and the criticism, just go easy on us. But we're really excited. I want to thank the nurses who are here to help us out. Again, everyone, this is just this is so cool. Thank you for making this happen. So, Abby, come and join me, and we'll make it official.
Yeah, same here. Sorry. I'm here in case you faint.
Thank you. I may need that.
Important question for you. Are you going to want a SpongeBob or a Scooby-Doo Band-Aid?
Definitely SpongeBob.
All right. Okay, left arm okay? All right, so yeah, how about this? I'll roll your straight up. We're going to hold it up with your other hand. And just relax. Relax. What do you say? There you go, yes. No.
I know.
We're ready over here. Okay, is this going to be a quick quote? Ready? You're done. Woo! That's SpongeBob. Okay, go. Move your arm around so it doesn't get so slow, okay? Congratulations.
Thank you. I know. She has a much higher level.
There you go. Vaccinated. Thank you. Thanks for being here.
Thank you all for coming. Just a reminder, you all know this, but if you talk with anyone, please respect their privacy if they choose not to speak. Thank you.